Good evening, everyone, and thank you for being here for the Maddie's Institute webcast, How to Stop Itching in Shelter and Foster Home Cats. I'm Lynn Fridley, Program Manager for Maddie's Institute. We are very excited to bring you the valuable information in this webcast. Our presenter is Dr. Karen Moriello, Clinical Associate Professor of Dermatology at the University of Wisconsin-Madison School of Veterinary Medicine. Dr. Moriello is a widely recognized expert in the field of dermatology, and we're sure that she will share some very useful information about itchy cats. Before we get started, we have some housekeeping items to discuss. Please take a look at the left-hand side of your screen where you'll see a Q&A window. That's where you'll ask questions during the presentation. Dr. Moriello will answer as many of the questions as she can at the end. But please don't hold your questions until then. Ask them during the event. Questions asked in the last few minutes will probably not be processed in time for a response. If you need any help with your connection during the presentation, you can click on the help icon at the bottom of your screen. You'll also see other little images at the bottom of your screen along with the help button. These are widgets that will take you to the resources that we wanted to share with you. The green file widget also contains a printable certificate of attendance for people attending this live event, with no quiz necessary. Veterinarians and vet techs will receive their RACE certificates within 2 weeks via email. Before I turn things over to Dr. Moriello, I wanted to say a few words about Maddie's Fund. We are the nation's leading funder of shelter medicine education, and it is our goal to help save the lives of all of our nation's healthy and treatable shelter dogs and cats. Our founders, Dave and Cheryl Duffield, were going through a difficult time in their life, but they were sustained by the unconditional love of their little dog named Maddie. She gave them such joy that they promised her that if they ever made any money, they would give back to her kind. Well, their dreams did come true, and they made good on their promise by creating Maddie's Fund, in honor of their cherished companion and the special bond that they shared. Please use what you learn here tonight to continue your life-saving work for animals. Dr. Moriello, thank you for being here this evening.
Thank you, Lynn, and I'd like to thank Maddie's for inviting me to talk to everybody this evening about stopping itching in shelter cats. I'd like to thank everyone who is attending, because I know that you have lots of places you could be, and to be on a Thursday night here listening about itchy cats is, huge dedication. Okay, so tonight's discussion is going to be about itching in shelter cats and in foster home cats, but primarily this is going to be talking about itch in cats, and this is probably the biggest dermatological problem that we deal with in cats, from kittens to older animals. And out of all the things that happen when an animal comes in to a clinic or for whatever reason you're examining it, if a cat's got skin disease and the cat is itchy, that's the problem you need to pursue. It trumps everything else because it usually tends to be the thing that is at the root. All right.
So we have our first poll question. We'd like you and the audience to be involved in this. So you can answer this question on your screen, directly on your screen, not in the Q&A box, but on your screen. What is the most common cause of pruritus, which is itching, in cats, in your experience? Was it ear mites, fleas, flea allergy, food allergy, environmental allergies, ringworm? That could be it too. And you don't know. So please select your answer on your screen. What is the most common cause of itching in cats in your experience? And we'll go on ahead and look at the poll results. Okay, Dr. Moriello, what do you think of that?
Well, I think that they could have saved my my next author's a lot of work here. Fleas and flea allergy is absolutely correct. Fleas and flea-related diseases are the #1 cause in all animals. We often felt that this was the problem and the cause, but we really didn't know it. And this paper here, Clinical Characteristics and Causes of Itching in Cats by Hobby, was listed by the Journal of Veterinary Dermatology as one of the 25 most important papers ever to be published, and it was only published in 2011. And this was a phenomenally important paper to feline dermatology and anybody who deals with cats. They looked at 588 paritic cats from 2 continents, 7 countries, and tons of veterinarians. And they weren't just specialists, they were private practice veterinarians. And the thing that was so amazing was they got everybody to agree to a standard workup, and a practical standard workup, so that we could get really usable data from this study. So out of this study came something called itchy cat odds. And so when we took all the data together and you looked at the causes, right away they found that of these cats, 29% responded to flea control, which matches pretty much what our audience said is being really common. Another 24% had non-allergy related causes. So for those situations where you're wondering whether or not it really is worth doing some of our basic tests, you bet. And in this non-allergy related causes, this is where we had viruses or tumors or even dermatophytosis, but it was not fleas. The next thing that was most common were feline environmental allergies. So just like dogs have got atopy, cats have atopy too. And cats don't do things like dogs do, so of course it looks a little bit different. And then, very amazingly, a very, very small and uncommon cause of itching in these cats was food allergy, which I thought was, kind of surprising considering the fact that as dermatologists were always doing food trials, but they had some clues as to when it would be a good idea to do that, and we'll get to that a little bit later. And then, of course, because you're dealing with cats, about 15% of the cats sabotaged the workup. I mean, they're cats. They just didn't want to play. They didn't finish anything. So for those of you who are trying to figure out, gosh, why can't I get this situation to work out? It's because, cats, they're basic saboteurs. But when I went through the data and pulled out every bit of the parasites, because there were some under non-allergy in that, I added up all of the parasitic causes, and 39% of them, of everything that causes cats to itch, responded to ectoparasite control. So that is a hugely important number, because right there, at entrance to shelters or any kind of facility, if you're applying flea control, you are doing one of the most important things you can do. And, for those of you who have been wondering whether or not there's any resistance to flea control products, there have been some studies conducted, and right now we don't notice any resistant pattern. So it's probably more to do with the burden than the products. Okay, so when presented with an itchy cat, the thing you have to do is, with cats you don't get that much time to do things because, it's all on their schedule. So the first thing you got to do is figure out whether or not this cat is ill or not, because that's a whole other workup. And cats don't show illnesses very well, and if you got a cat with skin disease and the coat is unkempt, you're much better going down that route. You may have very little information about things, so you're looking for any medication history for any disease, anything in the medical records. Do you see steroids? Do you see recurrent ear infections? Anything like that will help you figure out what's going on, because what you want to identify is itch, and then you want to identify how severe it is and a pattern if you can. And very importantly, before you even put your dose of flea control on, you want to see whether or not, has there been any other flea control on board, because that will help you determine what you may need to do afterward. Okay, so a big thing with cats is skin lesions after contact. And the first one is, of course, ringworm. Ringworm is not even one of the 10 most common skin diseases of cats all over in big retrospective studies, but it's an important contagious one. So contact are staph developing lesions after contacting the cat, and ringworm is transmitted by direct contact. The other things to consider are fleas and Chiletiella, the walking dandruff mite, ear mites, and chiggers. So anything, when you have a rash developing all over the body, that may be more parasitic versus focal spots may be more dermatophytes. And that information is important because it helps you sort out where to put your cats. Now, low-yield diagnostic tests. I see this a lot in cats coming in, and particularly a lot from situations where everyone's trying to do everything to save the cat, and they do a CBC, a chemistry panel, and a urinalysis. This is not very helpful information and not very good money well spent in a cat that's otherwise healthy. So I wouldn't pursue that. And as far as, right off the bat when working up these cats, hold off on food trials, hold off on allergy tests, and definitely hold off on blood tests for food allergies because they are absolutely not diagnostic. So you can just throw that piece of paper away. Okay, so that's a no. All right. So when we're working up cats, it's really important to sort of get your basic TPR, just like, when you have an ill animal, you need to do temperature, pulse, and respiration. Dermatologists really can't move forward without this information. And the bottom line is veterinarians can't move forward, or anybody who is collecting the information for someone to look at and assess can't move forward with getting a good idea what's going on with the cat until you get this. So the first thing is obviously it's a little bit different than in dogs. You do need to want to do a Woods lamp exam. Microsporum canis, contrary to what I said before and contrary to popular belief, the vast majority of lesional infected cats, M. canis, will glow. And we just know this to be from a lot of work that we've done, courtesy of Maddie's, helping us with shelters. This is really important, so you're looking for that. You may have to pull some crusts and stuff off, but use your Woods lamp. And fungal culture, use that with your targeted population. You may have a protocol in place. I'm not saying don't use it, but your targeted population obviously would be your lesional cats, inflammatory, Woods lamp positive, kittens. Hair trichograms, or plucking hairs, are very good to look for things like parasites, ear swabs for cytology, and skin cytology. And don't forget fecal flotations, particularly on itchy cats. Okay. Now, as I mentioned before with Woods lamps, it's very, very common, more common than not, to have a Microsporum canis glow. Now, the Woods lamp that everybody uses varies depending upon what practice you're in, but the one that I really like is the one up in the upper left-hand corner that's big, and it has a built-in magnifying lens in it. And when I looked at students looking at glowing hairs, when they looked at one with magnification and one without magnification, they found 50% more positive specimens. So we're missing them because we're not using magnification. The other thing is when you are using these, you need to get really close to the skin, with probably about the distance between the first digit on your finger. Get really close and lift up hairs to look for it. If you get a really, really good positive, take some Scotch tape, collect those hairs, and mount it on a slide, and then you've got a keep it positive control to use in your shelter or your rescue organization. You can put a little clear nail polish on the edges to seal it, but these glowing hairs will stay glowing for decades, and you can use it as a training tool. So it's great. All right. Dermatophytosis. Everybody asks me whether or not it's an itchy skin disease or not. It really depends upon whether or not the cat has other clinical signs. It causes inflammation, but the disease itself causes the hair to break down. It causes redness and heat, and that inflammation may be perceived by someone who's watching the cat to be itchy or not. So it's extremely variable. And so you just really have to do a little 5-minute watch on the cat to see, is this cat itching, or is this cat just have a really big red ear or lesion that looks like it may be inflamed when in fact the cat's not really biting and chewing at itself. Hair trichograms are nifty little tools that allow you to avoid having to do a skin scrapings on cats. What you do is you simply pluck hairs really close to the base, lay them in mineral oil, and put a cover slip on them, and then look at them for Demodex mites. And there's those little mites up in the top-hand corner. You see what looks like little alligators. Those are Demodex mites, and this is the best way to find Demodex mites on cats because it allows you to sample a lot of areas that you necessarily may not be able to do a skin scraping on. Now, as far as for skin scraping or skin cytologies, let's talk about the blades. We need to stop doing this. We absolutely need to stop doing scalpel blade scrapings with bloodborne diseases in cats and in people. We don't want to do that. It's too easy to cut the cat. It's also very expensive. And so instead, what I prefer are these little spatulas to collect samples for skin cytology. And these are essentially little weighing spatulas that you can buy from any one of a number of places, even Amazon.com. Oh, I'm not supposed to be advertising things. Okay, I won't do that. But it allows you to sample things. And especially if you look at that cat's nail bed there's some really important information there. How are you going to get it? You're going to go after that cat there with a scalpel? No. It's much safer for everyone. Okay. Now, skin cytology on cats is really very helpful. This allows you to look at what's going on in the cellular level, and the best way to do it with cats when you're getting from their hair coat is with clear Scotch tape. You just press it to the skin and to the hairs and get really close to it. Allow and stain it just like you would, except avoid the fixative, and allow it to dry. I use clothespins. And then after it's dry, it's really important to let it dry, otherwise you get streaking. You just place the sticky side over a drop of immersion oil. That is the key. That's the trick. Put it over a drop of immersion oil for mounting and then look at it, and you will get a very nice mount, and it will allow you to find things such as on the left, neutrophils and cocci, or on the right, you can see that those bigger organisms there, those big blue organisms that look like peanuts or circular dots, those are yeast. And these can be hard to find on cats, and this is one of the best ways of doing it. Now, cats are kind of unique a little bit with their malassezia or yeast, which causes a lot of itching. What you're looking at here is a slide with a lot of little blue dots, and everybody's probably appreciating that. And where the arrow is, that's a pretty big blue dot. And then there's some smaller ones. What you're looking at the arrow there is a malassezia, like you find in the ears, except in cats and cat skin, it's round. And those other dots are cocci. So yeast in cats are round and much bigger than cocci. And so to try to remember this, think of the moon and earth kind of scenario, with the earth being the bigger yeast. And this becomes important because when you're looking to try to determine, do I need to give this cat an systemic antifungal, you're looking for this kind of evidence here. And if you're not aware of that size differential and the fact that there's all these different species, you might miss it, but that will be helpful. Okay, so step one. So in cats with itchy, I have a steps protocol. And the first one, as we all already can predict, is parasite control. And the first thing is, do you have a mad itchy cat? These are the cats, like this cat here, that absolutely mutilated itself in the examination room, just would not stop chewing when students and I tried to touch the kitty cat. He bit us because he was just so crazy itching. And mad itchy cats, the clinical thing there to think about, that is a clinical sign of Demodicosis, which is a contagious parasite. And it can make cats as itchy as those of you who listened to the dog lecture last week, like the scabies of dogs can just make them itch regardless of what you're doing to them. The same thing with Demodicosis. These cats can't sleep. If you have that, you need to jump right away to treating for suspect Demodicosis if you can't find the mites. However, if you just have an itchy cat, the first thing you want to do is you want to get your flea control on board, because you want to look at flea control response to parasites. And these are fleas and the dandruff mite and ear mites, and notoridres and scabies are the scabies of cats. And increasingly, we are finding that cats do have, we always thought notoridres was the cat scabies, but cats may actually have their own Sarcoptes mites, just like dogs do, because we're finding more and more reports of this, and it's because those two mites look together. But the hallmark with both of them is a lot of itching. Okay, fleas. If you haven't seen a flea up close, you're looking at one now. The classic situation for fleas is the itchy cat, back end of the cat itch. That's the number one. And that's always coupled with flea allergy dermatitis. And cats with flea allergy dermatitis very typically have a back end and face kind of distribution, because the one place that cats can't lick and chew and eat off fleas is on their head and neck, so they'll get a lot of facial lesions up there. So that kind of pattern is very, very helpful in sorting it out. Okay, Cytology, or the dandruff mite. This is one that is probably underdiagnosed because we treat everyone for fleas, and fleas are very susceptible. This mite is very susceptible to flea control. But if you're just giving that first admission treatment of flea control, and 30 days, 60 days later, the kitty's still with you, and the cat's still itching, and you see a lot of scaling, it's possible that that cat may actually have Cytology. And so the hallmark there is a lot of scaling on the back and on the dorsum. It's highly contagious, and usually people are affected, and they feel very itchy after touching cats. And of course, everybody here knows ear mites, and you guys probably got much better pictures than I do of ear mites. But The classic little kitten with the coffee ground ears is one of them. Another one that we see a lot of are cats with hypersensitivity disorders to the ear mites. So there's just a couple present, and it causes intense itching. Any cat that's coming in with a cauliflowered ear mites are the number one cause of oral hematomas, or the blood blisters in ears, where they sort of you'll get an accumulation of blood between the tissue ears, and you have to lance that. If it's left untreated, and it will heal. The cat's ears all crumpled up. So that's your big clue that you may have ear mites present. And, of course, this is our little kitten here. This one doesn't look like it has the classic coffee grounds because it doesn't. But what it does is it just had ceruminous discharge. And so this little kitty just had kind of waxy ears, but there were ear mites in there. Okay, and again, this cat was presented as a mad itchy cat, and we were treating it for, the plan was to treat it for Demodex gatoi. However, students found a lot of wandering mites, otodectes mites, ear mites on the body. So this cat may have had two problems, but it highlights the fact that ear mites can be very, very itchy and a hypersensitivity. And as a matter of fact, they are a zoonotic disease. The other thing, when you're looking at cats' ears with ear swabs and mineral oil, is to look for Demodex, because I've diagnosed a number of cats that are very, very itchy by finding Demodex mites in their mineral oil ear swabs. So don't neglect to do that. And lice. Lice are big. Lice are attached to hairs. Cats have one biting louse. Again, very contagious. It's usually a disease more of contact and close quarters in that. Many times, this particular cat came in and it had everyone liked the little ticking on the hairs, little different colors. And in fact, I'm looking at it really close going, oh, that cat's got lice. Very treatable. Very treatable with flea control. Probably since it's all on the cat's body, probably a whole body spray with fipronil or Frontline or any other flea control product would be really good to kill the eggs that are on the hairs, because lice lay their eggs on the hairs, and what you need to do is kill them so that they don't reinfest it. So using a topical and a spot-on will work really well. Lime sulfur is great for that. Okay, this is the classic Notoredres cat scabies. Crusty cats. This is an alarming situation. I mean, it looks alarming, but the first thing you want to do is obviously scrape this, and you want to chop up those little crusts. These mites are easy to find. You will find them very easily. Bigger problem in the southern part of the United States than in the northern part, but cats tend to move around a lot now, a lot more than they used to, so you can find it anywhere. But it's a big differential in cats like this, and usually the cat is also systemically ill. Now, cats have a couple other weird things they do with insect bite. They will get insect bite reactions, and they can be quite marked. The first one that they will get is a hard lump at the site where either a tick has bitten or where on the cat's ears here. This particular cat was swarmed by little flying midges, culicoides, black flies, whatever, or even mosquitoes will do it, and they will get these little tiny, little rock-hard hard nodules. And what that is whatever bit them injected a little bit of, in the process of biting, a little bit of venom in there, or whatever it is that causes it, and causes the skin there to get inflamed and the skin collagen supporting tissue to break down, and they get a little nodule there. And these can be very, very itchy. They're usually bilateral, and interestingly, they tend to be a lot on darkly haired cats, because flying little biting insects are drawn toward darker faces. So this is another classic situation, which is almost a recognized at the time the cat comes in. This is insect bite hypersensitivity, and you can see it on all three cat noses. The defining thing here, or the unifying thing here, is the cat was going outside, and the cat had these facial lesions, and the cat's black. And when you do a cytology, you see lots of eosinophils on this. These cats very typically have the history of being outdoors. This looks terrible, but these cats get better within just several days of being taken out of exposure to insect bites. Treatment-wise, these cats will get better all by themselves. They may benefit from some additional antibiotic therapy. If the cat's really mutilating itself, it may need some antipyretic therapy with a short course of oral prednisolone. and I mean just a couple of days, to decrease the itching. But again, these mosquitoes tend to bite in really thinly haired areas. Okay. So your very first step when you're presented with this itchy cat and you're going after fleas is to decide one or two things. Do I just have itching without inflammatory lesions? If so, you just go with flea control. That's the thing. If there's a lot of inflammatory lesions, exudate, just more, kind of like the cats I just showed you, those animals need flea control plus antimicrobials, because what you have there are secondary infections. And cats will, the little plaques or the oozy kind of draining lesions that they get from itching and scratching, those are the hot spots of cats, and they are very, very intensely itchy. So that's your goal. Okay, now, you've got your cat, and you've got your flea control on board, and you've either gone with infection control or you haven't. If it's a pure situation where you've done just flea control and the cat's still itchy, then you go and you back up and you say, well, maybe I've missed a skin infection. Now, dermatophytosis, again, any cat that's still itchy, obviously in a multi-cat situation, we would lamp the cat. Your target, though, is going to really probably be your suspects, which are going to be mainly your kitten population. However, cats get bacterial and yeast infections really commonly, and they present in many different ways. Failed flea control and the cat's still itchy, the hallmark there I think about is bacterial and yeast overgrowth. And cats will get this dandruff in their hair coat. Remember, you've already taken care of if you've got flea control on board, you've taken care of all of your flea control responsive mites. So what's the cause of the dandruff? And it's likely to be a bacterial infection. And the bacterial and yeast infections can cause patchy hair loss just in dogs. And if you look really close, sometimes you can see epidermal collarettes, like up in the left-hand picture there. Sometimes the cat, like on the right-hand side there, just has sort of a dirty forearm. It's kind of just brown. Looks like lick marks when dogs are licking themselves, salivary staining. And you do cytology on there, and you will find cocci, and you'll oftentimes find yeast there, typically very closely together both. Now, when would you might culture a cat like this? Cultures are generally not necessary because most of our cats haven't been exposed to antibiotics. But if the cat is sick, the cat has had a history of the antimicrobials before, the lesion wasn't responsive to your treatment, the best approach may be to do topical therapy, then you might want to get a culture and you simply roll a cotton tip swab onto the lesion, or if it's a dry area like in the lower right-hand corner, moisten the tip of that culturette, roll it into the scales and everything, and what you're looking for there is what's growing, and you're looking to see whether or not you've got an antibiotic-resistant staph, a methicillin-resistant staph. They're not that common in cats yet, but they're increasing enough where we need to be aware of them. Other situations where you need to think about bacterial pyoderma, where we didn't used to think about it, is cats with miliary dermatitis, the kind of lesions that when you're touching the cat, you feel them first, those little crusty hemorrhagic bumps. Those are signs of pyoderma in cats. And if you clip the hair coat on some of these cats, like in the lower right-hand corner, you see those little red dots. You'll actually see almost the same kind of lesions like you will see in dogs. Okay. So on your cytologies, what you're really looking for is, do I have yeast? Because that question, if you find a lot of yeast present, then you're going to want to be considering using systemic yeast antifungal drugs such as itraconazole. And that choice is expensive, and that choice, is something that you need to kind of balance, because if you just have a bacterial infection, we can pretty much do topical therapy. But if the animal's got it pretty widespread and the cat's really itchy, systemic therapy may be indicated. A very common cause of cats with recurrent ear disease that doesn't get better is yeast otitis. And it may have been treated with steroids, and it may have been treated with Conifite or some other local antifungals. But if it's that recurrent, then you're going to want to consider, I bet that malassezia requires systemic treatment. Now, a couple other lesions I want to bring to your attention. Eosinophilic plaques, the ulcer lesions on the lips of cats, or those moist lesions on the raised lesions on the skin, or lick lesions. Again, as I said before, these are the hot spots of cats, and now we know that if these lesions are coming back after flea control, there's an underlying itch there. There's some kind of a trigger. It's probably infection, and what these need to do is be treated. Maybe the cat that when the first cat came in, it had these lesions, and so you've gone on with the antibiotics and flea control, or maybe the cat was treated with flea control, but it's still itchy and it develops these. And these lesions can develop very quickly within just a couple of days. So that is something to consider. How quickly did this come up? And again, your cytology will be helpful. That little lesion on the cat's lip where the melting lesions are up on the left, increasingly, those are caused by fleas and flea allergy because cats will get bitten on the lips, and the lips kind of melt. But it's also one of the clinical signs that you should keep in mind of a cat that if you're seeing this, it doesn't respond completely to antibiotics, that's a cat that might benefit from a food allergy trial. Okay. So what do we do for antimicrobial therapy? I'm an advocate of topical antimicrobial treatment. You can use shampoos. You can use chlorhexidine spray. You can use accelerated hydrogen peroxide. If you need to go with an oral antifungal, you want to go with itraconazole. And I use the standard dose that we use to treat for dermatophytosis for that. And we'll go with anywhere from 14 to 30 days. And systemic antibiotics, increasingly based on culture where you have a situation where you do need to use antibiotics right away, culture is not an option, or you feel an antibiotic is a good choice, then sulfoxaflor, which is the injectable antibiotic, is a very good first choice. And a big thing here is if you're going to go this route, you want to go with 30 days of treatment without any steroids on board, because steroids will mess up your ability to determine what's going on. Okay. Now, when systemic antibiotics are not an option, again, as I mentioned before, you can go with a lot of topicals. There's another product here I really like. It's a chlorhexidine clombazole mousse. It's just like a hair mousse. It's called Duoxo mousse, and you just shake it up and you just rub it into the cat, and it's extremely effective and very well tolerated for them. And clombazole is not only anti-yeast, but it's also very effective against dermatophytes. Okay, so you have a 6-week triage plan of your cats. You're either going just with flea control or you've had to go with flea control and antimicrobial therapy. So what happens? Okay, once you get parasites removed from the equation here with your flea control, and you've either initially treated with antibiotics and antifungals or you've done it as a follow-up, those are gone. What happens? Okay, that's what you're looking for. Well, the first thing that can happen is you could be in a good place. You can have a happy cat. The cat has stopped itching. What was the trigger? We don't know. We know that our parasite control, infection control has resolved it. What do? Well, we just wait, watch, and document. That's all we need to do, because you could essentially be done. You may have simply had a situation where you had itch and infection. There was a trigger. It was a one-time trigger, and it started in a perpetuated infection, and perpetuated itch, and it was round and round it went until you broke the cycle with parasite control and infection control. And a lot of cats will have this. Very, very common, especially in cats that just are exposed to fleas. So when you're wait and watching and documenting, some of the things you need to remember is don't stop flea control, because until this cat gets a home, fleas are the biggest problem, and it's like 39% of the chance he's going to get a parasite. Keep that on board. And don't change the food for any particular reason unless it's due to gastrointestinal signs, because what we have here is a really important piece of information, a cat that got better with flea control and antimicrobial therapy, and we don't want to add in a complicating food trial. And cats, if you change their foods around a lot, they can change a lot of things with how they act, how they groom, and if they stop grooming, they can get a bacterial infection of the skin, and you can sort of introduce a variable there where there wasn't one, and it can be problematic. And you just want to watch for signs of relapse. So that's not too hard to do. Now, what if you come 6 weeks later and you got parasites gone and you got infections gone? Then what? You're not in a good place, okay? So what is it? Well, first of all, it could be one of those others, the ones I talked about, 24% were other. It could be Demodicosis gatoi. We still haven't done routine flea control products. Don't necessarily get rid of Demodicosis gatoi. You have to be very aggressive to get it. And if it's still itchy, that may be a situation. Or it could be food and or environmental allergies. And those are your choices. Okay. So, next step. At this point, in the situations that we're talking about here, I would rule out Demodicosis gatoi because it's a contagious parasite. it causes intense itching. You want to continue your flea control. You want to make sure it's not there, because anything further that you're going is talking about long-term medical management, and this is a treatable, curable disease. Now, cats, again, the usual presentation is the mad, itchy cat, but, you don't know where you're coming in on the workup and everything, so just, to really find a mad, itchy cat, watch them for 5 minutes. That's usually the presentation, but not always. The pruritus scale, when you're looking at this is a visual analog scale. It's a really good tool when you are trying to work with itchy cats, because what it does is it gives you a scale from a normal cat at the bottom to extremely itching, and it gives you little descriptions. Okay, extremely itching, almost continuous. To a normal cat, I don't think itching is a big problem. Or little things in between. Well, the cat's not itchy when he's sleeping, but maybe just a little bit when he's playing. It gives everyone it levels the playing field when you're asking about itch. And all you do is when you are working with people, that is tell them, make a hash mark. Where's that cat itchy? And usually with Demodicosis gatoi, that hash mark is going to be pretty high up because it's like the scabies. They're pretty itchy. Now, cats have two types of species of Demodicosis. One of them is long and thin. The other one is short and fat. There's a third kind of morphology, kind of a little stumpier one that's been reported in the literature. And very fancy DNA diagnostics have found out, nope, cats only have two species. They've got Demodicosis gatoi, the little guy, and Demodicosis cati. The thing with Demodicosis gatoi is it's very itchy. The thing with Demodicosis cati is it tends to show up in cats that are systemically ill. You can have mixed infections, but you should get worried about a systemic illness if you just find the long, thin mite. Okay. Cats that just...
Excuse me, Dr. Moriello?
Yes, am I getting lost there?
Could I get you to clarify something for us?
Yes.
What was the first-line systemic antibiotic that you mentioned a few minutes ago?
Cefovicin. And veterinarians in the audience will know what that is.
Okay, great. Thank you.
Okay. Yeah, cefovicin. Okay. All right. Back to Demodicosis. Usually it's a hair pulling out. It'll be very, very aggressive. The cats will have hair within their cages. Sometimes they'll be bald. It's a major differential for bald belly syndrome. And that's Demodicosis gatoi. But if you have a cat, you just clean the cage, you come back and you find hair in there, that's something to think about. Okay. Over-grooming cats. Cats that are over-grooming on their abdomen in the absence of a medical problem, the big differentials are Demodicosis gatoi, fleas, and food allergy that can be worked out and worked through in shelters and in rescue situations. But start with Demodicosis gatoi. And the Demodicosis that you're looking at there on the right-hand side, that was found on a fecal examination. Cats groom these mites off. They're very tiny, but wow, they're not digested by their GI tracts, and you can find them on a fecal, which is great. Okay, so here, unlike dogs, a negative hair trichogram or skin scraping doesn't rule out feline Demodicosis. In dogs, if you've got a negative trichogram or skin scraping, you don't have Demodicosis at that moment in time. In cats, not the case at all. And why? Because they're cats. That's what they do.
And we have our next poll question. Yes. This is your chance to interact. I want to let everybody know that you need to get your questions in to Dr. Moriello, and you would do that in the Q&A window. For this poll, you will answer on your screen. So how do you treat feline Demodicosis? With ivermectin, lime sulfur, selamectin, fipronil, which is frontline, moxidectin, which is a compound like Advantage, or not applicable. So please choose your answer. I'm sorry I stumbled through some of those pronunciations, but so how do you treat feline Demodicosis? Please answer on your screen. And there's our results.
All right. Everybody's doing pretty much what I do. Ivermectin is probably one of the most common and the most effective treatments that we've used. Lime sulfur is up there too as a topical. Selamectin hasn't worked very well in my hands. I'd be really interested in, Lynn, if anybody emails you and tells you that it's worked, let me know how they've used it, how they applied it. Fipronil has worked in a small number of cases, and moxidectin or Advantage is starting to increasingly become a very good choice, but you need to use it a little bit differently. Okay, so how do we do this? Lime sulfur is weekly, once a week. And the nice thing about lime sulfur is not only is it anti-everything, itch, parasites, and infection, and antifungal, but it provides sort of a coating on the skin, and so for contagious diseases, it has a residual activity, so it's really good in multiple cat situations to provide not just protection and treatment in the moment, but for a little bit longer. Ivermectin, that's lime sulfur is weekly for 6 weeks. Ivermectin is once daily for 6 weeks, and of course, you have to give it to cats orally. Sometimes they don't like it, but it is very, very effective and relatively inexpensive. If you're going to be using Advantage Multi, at least weekly for 6 weeks, and then the Fipronil spray, or which is a frontline spray, use that weekly. And the reason I'm saying the frontline is because it has a residual activity for a week. I know for fleas you can use it for about a month. It's really good, but for Demodicosis you want to use it weekly. And the thing here is you need to treat all the cats in contact. So that becomes a little bit of, kind of a little bit of effort when you've got a cat in a multi-cat situation, but you need to treat everybody. And that's why some things like Advantage are really coming on board and being really useful. Okay. So if we've gotten through our triage of parasites and infections, and the cat's still itchy, you've done your Demodicosis thing, before you move on to looking at other causes, the one thing to do is to take a step back and think, could it be some other disease? Many of these other diseases, such as medical problems and that, will develop, can be itchy before you see clinical signs of it. So other things, such as autoimmune diseases, fungal diseases, other than dermatophytes, or maybe a dermatophyte, but you can have some of the intermediate fungal organisms, like sporo and that, cancer, neoplasia, viral diseases, deeper bacterial infections. It could be a medical problem, systemic medical problem, or even trauma. Such things as burns or electrical injuries can occur, and it will be weeks and weeks before you will notice that the skin is dying where there's been the trauma or a burn, but yet the cat may be painful, and that may be interpreted as itch, or may even just be itchy in that area. So, however, the big thing that we see in cats in looking for other are things which are a little bit more familiar to us. In over-grooming, the big thing to consider is itch. Is it itch or is it other? The cat up at the top was a belly grooming cat. Just would not stop. And we went through the entire triage, and then somewhere along the line, we decided, we're going to radiograph this cat, and this cat had bladder stones. And since then, I've been looking a lot more, not just for bladder stones, but urinary tract infections, any kind of abdominal discomfort. Cats that have got food allergies, but also with the GI component, will oftentimes lick their abdomen because they're painful. Some cats are lick their abdomen when they have, they'll have lymphoma of the GI tract, cancer of the GI tract, and they're painful, or liver disease. So those are some things to think about. It may just start out, and it makes sense because we kind of hold our abdomen too when it's painful. And then there's a very interesting over-grooming cause that very well could be overlooked. And this is a little cat down in the corner. And he's got kind of like little semicircles of over-grooming. And that's a very weird pattern. And what was published in literature, and I actually saw a case of this before many years ago, and it is this cat, is cats with pelvic pain for any reason, arthritis, or a fracture like on the left-hand side, or in this cat's particular case, he got run over by a tricycle, will overgroom. So if you have a lot of overgrooming on the lumbosacral area, or a cat that's kind of growly, think about pain, because we really do underdiagnose arthritic pain and discal spondylitis, back pain in cats a lot. And so, sometimes before you move on, a trial of pain medications may be indicated under the direction of a veterinarian. Okay, what about a skin biopsy and an itchy cat? Well, to begin with, if a cat walks in and is presented to you like this, even while you're getting that bottle of flea control, go ahead and plan to do a skin biopsy, because this is a very dramatic-looking cat, and whatever this cat has, that skin biopsy may be the only thing that's diagnostic and may save that cat's life. Because this disease that you're seeing here, this dramatic cat, could be anything. It's a great test question because students can write almost any answer and it's right. And it is. This cat here, this cat was an allergic cat that had secondary infections and also had Demodex. Had all those things going on. And so it was just the worst of the worst of the worst, but we were able to sort that out. But yeah, we did biopsy this cat. Okay, now, other diagnostics. This is where other things become really important. If the cat isn't better, you may need to look at routine laboratory work, CBC, chemistry panel, urinalysis, thyroid tests. A lot of cats that have got recurrent, have got hyperthyroidism will stop grooming, and then they get bacterial infections and yeast infections. Some of these cats that stop grooming will also be the ones that tend to get more flea infestations because they're not grooming and removing fleas. And again, do a skin biopsy here. So these are the things that, this is when it comes into play. So what are some of the other diseases? Well, I really talked a lot about doing skin cytology as part of your core diagnostics. This cat was a big surprise to us. This is a 9-month-old Siamese cat with lesions on the ears and the face. And it could, it's not a black cat. It's not your typical Siamese. It's one of the lighter colors. And, it looks like some of the cats I've seen with insect bite hypersensitivity. The initial cytology showed a lot of eosinophils. When we digged a little deeper, we found a totally different pattern. So those big blue cells there, those are cells that we see in an autoimmune skin disease called pemphigus, and they're found on cytology. And that can be a disease which can be very, very itchy. It usually doesn't show up in 9-month-old cats. It's very rare, but it did, and we made a diagnosis here. And it wasn't something that we expected. So this cat got caught early, but you could have an adult cat come in with pemphigus, and again, repeat your diagnostics to look for things. Look at the crust. Look around the nipples. In cats that are sick, lots of times you'll find a lot of lesions around the nipples. And then you can have cats that come in with very dramatic lesions, either at the start or, as in this cat's particular case, came in and these lesions developed during the triage period of 6 weeks. And this is very, very thick crusting on cats. And this cat had a thymoma or cancer in the thorax, and the particular syndrome was diagnosed on biopsy. But this cat got sick very slowly. So, it's not always that obvious with cats. Remember, they sabotage things and they're difficult to work up. So if we're through all of that and you're absolutely confident, you got a healthy cat, still itchy, none of that stuff's going on, you got flea control on board and everything, you're now into the allergy area. Okay. And the allergies of cats are flea allergy, environmental allergies, and food allergies. The treatment of choice for flea allergy, obviously, is flea control. If you get this far in your diagnostics, you've already got flea control on board, you're not dealing with flea allergy unless there's been a break in the appropriate treatment. And you just need to kind of look at that. Has someone forgotten? Is there new animals involved? But cats with flea allergy, dermatitis, you can also sometimes get a lot of immediate relief by giving those cats about a week's worth of Capstar. And if they've got flea allergy and they get bit by fleas, those cats will get remarkably better. So that's a really good, cute, very quick test to look for that. However, once you get past that, this is one thing where, cats are not small dogs. Well, this is the one time, at least in dermatology, where cats are a lot like dogs. After you get to flea allergy, you can't tell the difference in between a cat that has food allergies and environmental allergies. They're essentially indistinguishable. There are some things that will help you at this point, though, sort it out. And this was in a retrospective study of cats with environmental allergies or feline atopy. What was reported these were cats from the general population was that the itching was severe and it sort of waxed and waned. It was, just came and went. And it was persistent in the face of flea control. And interestingly, cats were not very steroid responsive, a lot less than what everybody expected an allergic cat to be. So just because a cat doesn't respond to steroids or you have that history doesn't necessarily not make it a cat that doesn't have environmental allergies. Cats are just more complicated. And this little study confirmed what I see a lot in my private practice, is that a lot of allergic cats do pretty well on antihistamines, a lot more so than we would think and a lot more so than dogs. And again, 50% of them had bacterial infections. But the bottom line is they were itchy in the face of flea control and with infection control, and the itch wasn't anywhere near what you might expect to see with Demodex gatoi. Demodex gatoi will not give you a waxing and waning pruritus. It's there. It's going to be crazy itchy until that cat is better. Itching that comes and goes is more consistent with allergy. And allergic cats sometimes just look rumpled. And that's what this cat just looked rumpled. His hair was kind of undone, a very young cat. He was just kind of always biting and pulling at himself. So we got through the entire workup, and here we are. And he would create these little, essentially, cat hot spots all the time and just pull them out and really, really go at himself. And so this is really typical of cats. Other things that cats do when they have allergies is they may do a lot of facial rubbing. One thing you'll notice here, though, is that any cat that's got facial rubbing and they're really, really itchy, they oftentimes beat up their whiskers a lot. So in this particular situation, this cat not only did have allergies, but he had really horrid dental disease. So some of his facial itching was also from pain. If it's not just on one side, you obviously need to consider dental pain, but always rule out pain because pain and itch in cats can be so subtle and hard to tell the difference. Now this is a cat with severe allergies who's really done his whiskers in, and this cat just rubbed his whiskers off, and they will do that. They'll just break right off. Okay. Other signs of very subtle, you'll see hair loss on the chin and around the lips. These are allergic cats that many times are not observed to be itching because when they get infection, when they get attention and affection from people, they're going to go for that. They're not so itchy that they can't be loved and hugged. But when you start looking at them a little bit closer, what are they doing when you're not there? What are they doing in the closet? Okay, well, they're scratching at their face and everything. And you will see this sort of hair loss and lips. It tends to be symmetrical. Recurrent ear diseases in cats, very big causes. Allergy, need to consider obviously yeast as we've talked before, but the hallmark of allergies is something's recurrent. And if you're doing a good job with triage, but yet this cat breaks with infections, and yet this cat breaks with ear disease, you're down probably in the allergy area if you have ruled out any kind of resistant organism that's present. We've talked about the symmetrical alopecia, but these cats will be allergic cats. Once you get through Demodex, you're looking a lot at, and there's no other disease, you're looking at food allergy, and you are looking at environmental allergies. And if they are still looking with symmetrical alopecia in the presence of flea control in that, these cats need to be worked up for that. The cats, there is a big, this whole cats with behavioral licking is extremely, extremely rare. Cats just don't do that nearly as much as the literature and the internet would suggest. These cats have a medical problem, and it sounds somewhat uncomfortable for the cat. But if you put an e-collar on this cat and kept him from licking, the hair is going to regrow. So that wouldn't. This cat is, if you can keep him from licking, his hair is going to regrow. So what is he doing? He's traumatizing himself. Why would a cat traumatize himself and cause pain and damage? They're going to do that because they're uncomfortable. Okay? Now, cats that have got behavioral problems, usually a good history will tell you that there's not just self-trauma to the skin, but there's a lot of other stuff going on with that cat, litter box and voiding areas, maybe interpersonal skills aren't the greatest, or more suspect toward more overall behavioral things. But cats need to get a break here, and we need to drop this behavioral licking thing from cats. Anytime you have ulcerative lesions on the neck that keep reoccurring, these cats need to get pursued for food allergies and environmental allergies, big time. Okay. Now, regardless of whether it's environmental allergies or food allergies, there's always medical care involved. There is no way you can get around it. You're always doing flea control. You're watching for infection, and because we don't want to keep giving systemic antibiotics or oral antibiotics, and cats get sick and they get diarrhea, we're talking a lot about topicals. And you're always using some type of humane antipyretic therapy. I mean, we have to control the cat's itching at some point. Sorry, Lynn, I jumped in here. Your choice.
Oh, great. We have another poll question. I would like to remind the audience that you can download or save the certificate of attendance that's in the green file widget at the bottom of your screen. So the poll question is, what drug do you use to manage itch in allergy cats? Do you use antihistamines, steroids, essential fatty acids, cyclosporin, or not applicable? So please, what drug do you use to manage itch in allergy cats? And we will go to the results. Looks
all right.
Like antihistamines takes the prize.
Absolutely. That's what I use, because they're over the counter and they're relatively safe, and they do work in cats. And you know, there's a lot of antihistamines I like, and we'll talk about those a little bit here. Controlling the itch, that flea control's on board. I know I'm beating everybody on the top of the head with it, but you'd be surprised. Ears and eyes. I worry about itch in those areas, particularly the eyes, because I've seen cats with corneal ulcers. So you can use a ophthalmic ointment such as Neopolydex on the skin around the eyes if the cat's really, really itchy. You do need to be careful, though, about herpes in that, to make sure that what you're looking at really is itch. Obviously, topical therapy to control bacterial infections. Cats really do really well with, if you spray chlorhexidine spray onto a brush or a comb and comb that through the coat. That's an excellent way to groom them and control overgrowth of bacteria, and even to treat an active bacterial infection, the dry, flaky kind of bacterial infection. You can use antibiotics on some of those ointment ulcerative areas, but when you need to do chronic therapy like that, that works really well. There are steroid sprays available that can be used on cats. I tend to try to avoid using them because one particular one has gentamicin in it, and that can set us up for resistant infections a lot of places. And the other thing with cats is, in order to really get a lot of control of the itch, you need to spray them with these steroids fairly thoroughly. Cats will then groom it, so they're not only getting it through their skin, but then they're ingesting it. And you can have a lot of cats get systemic signs of, just like as if you're giving oral glucocorticoids, from some topicals. There's some newer steroids coming out that are sort of low-dose soft steroids that just work in the very top layers of the skin. They've been used in cats. It's not available in the United States, but hopefully it will be soon. Cyclosporin is very effective but expensive, and obviously there's oral glucocorticoids which can be used. So to kind of digress a little bit about antihistamines, some of my favorites are Allegra and Zyrtec. Those two seem to work really well in cats. The thing with both of them is you do need to, they're may need to be used twice a day, and it may take anywhere from 7 to 10 days to see efficacy. For those people interested in dosages, you can look that up online. But they do work. You can also, essential fatty acids take a long time to work. There's sort of a slow onset. But if you've got a cat that you've diagnosed with environmental allergies and it responds to to antihistamines, you can add in essential fatty acids, and you may get that cat a lot of relief. Probably the easiest way to add in essential fatty acids is to use a diet that's fortified with them. And if you can get control that way with maybe some spot therapy, that's great. That is absolutely great, and that's maybe all you need to do. And with cats, once you're down to, it is the itch of allergy, you are looking at medical therapy. in the absence of a cat having a GI problems where you want to go for food trials, the other option you have is medical therapy targeting the itch a little bit more aggressively, and one of them is feline cyclosporin or atopica. This product is very effective. It is used at a higher dose than you do in cats, in dogs. It is expensive. It will cause some GI signs, and you do have some concerns, about toxoplasmosis. There have been some cats that, while they have been receiving cyclosporin, have been immunosuppressed enough, and they have developed toxoplasmosis. You can go ahead and you can screen for it, but the problem is its development of the disease with this is really very unpredictable. Any cat that gets systemically ill or any cat that gets respiratory signs on this drug, you should immediately assess for that. Now, if you got a cat that's responding to cyclosporin, the nice thing about it is that you go once daily for 30 days, and then you can generally get most of them off to every 48 hours, and then the cat and you can then have a relationship. And so, that is definitely something to consider. Now, if glucocorticoids are in the cat's particular best interest, the drugs that are often used are methylprednisone, triamcinolone, and prednisolone. Now, in a couple words about prednisolone, there's prednisone and prednisolone. Prednisolone is the drug that's active in cats, and that's the one you want to do, and you definitely want to use. One thing which has just recently come out in the literature about this drug is that there's a difference in the way you need to dose it. You can't dose it based on how much the cat weighs. You need to base it on lean body mass, because cats that are, over-conditioned will have excessively high levels of prednisolone for longer periods of time in their body, and that may predispose them to diabetes mellitus. So what we want to do is use lean body mass. And obviously, in an over-conditioned cat, other options may be a better choice. And methylprednisone and triamcinolone, these are drugs which are really very effective, and the recent literature has shown that the amount of drug necessary to put a cat into itch remission is far smaller than what we thought used to be, and that maintaining them into remission is remarkably a lot less. And that information is pretty widely available online too. You can just go ahead, and it's been published in the Journal of Veterinary Dermatology, and you can find information on that if that is if someone is particularly interested in that. But the thing to remember with antipruritic therapy in cats with steroids is that if you are totally knocking out the itch, you're probably over-medicating the cat. And glucocorticoids long-term are not a good way to go because they do predispose the cat to other infectious diseases. They're immunosuppressive, obviously. Diabetes mellitus is a big one. And, long-term wise, if this is where we're going, that's when you need to start talking to whomever's taking care of the cat and say, you know what, I think we may need to go ahead and consider a little bit more aggressive treatment, such as, let's go for food trial, let's go for allergy testing. Now, a cat that's just a little bit seasonally itchy, no problem. These would be very good choices. I am a fan of the oral medications because once you give an injectable, you can't take it back. But with oral drugs, you can stop it if the cat's having problems. Okay. Now, advanced diagnostics. You've got a cat, flea allergies out, maybe you get some medical management on board, maybe steroids are an option, maybe cyclosporin is not an option. You really do need to get to a definitive diagnosis for whatever area. So you're left with a food trial and you're left with allergy testing. When you're talking about allergy testing, you're talking about skin testing combined with blood allergy testing, and a big question there is for whoever's making the decision is, are we going to go with allergy shots or drops in the cat? Now, I am a big fan of food trials being done before any cat is skin tested or worked up for allergies with blood testing and skin testing, because that is something which is you can do. It's manageable. At this point in the workup, it's appropriate to do if it can be done. And cats with food allergies respond pretty quickly to the food, and then that's something which is, very, very manageable in the long term. But some facts need to be kind of like in play. First of all, you need to really know if the cat has year-round itch. Is it documented somehow? Is it itchy in the face of all that good core treatment? And so make sure that's it, because a cat that only has itch for a couple months a year isn't going to be a food allergic cat. Make sure flea control is on board. The cats that you might want to consider doing it in a little bit sooner rather than later, the cat with the ulcerative lesions that I showed you earlier, and cats that have got gastrointestinal signs with skin disease. In Hobby's article that I mentioned at the very beginning, the one thing he found was that cats with food allergies tended to be the ones that had more gastrointestinal signs, but they weren't necessarily the vomiting and overt diarrhea that you'd expect. These are cats that oftentimes had a lot more soft pudding-like stools in their litter boxes. So, if that's of help. And they also had more ulcerative lesions on the head and neck. So those are some things that might push you in that direction. Now, a food trial is a major lifestyle change for a foster family. Clearly, in a situation where you've got the cat housed in an individual cage, it's a lot easier to do. But when you're doing a food trial in a family home, what you basically have to do is feed all the cats the same thing. And you need to make sure your cat isn't going to be doing any counter surfing, and that all they're going to be able to eat is that cat food. So if you've got a cat that's addicted to Cheerios and can find a Frito, in the White House, a single Frito, you have a difficult challenge on your hands there to do a food trial on that cat. So food trials, what are the risks? One thing about cats and food trials is you do need to make sure they will eat the diet. And the diets that you want to try are commercial. You want to try hydrolyzed diets and see if your veterinarian or whoever else you're getting the food from will give you a taste test, gradually introduce it over about a week or so to see whether or not the cat will eat it. Some cats, it's no big deal. But cats, if they don't like the food, will literally just starve themselves into hepatic lipidosis, just starve themselves to death. They can be really, really difficult. The home-cooked diets, yes, you can home-cook a diet for cats, but the problem with a home-cooked diet is once you do that, you run a couple risks. Some cats can get addicted to home-cooked diets when they don't have a food allergy. And then if you do have a cat that has a food allergy and they're on a home-cooked diet, then you have to either cook that diet for the rest of the cat's life or go through a very tedious protocol of introducing things into the diet to see if you can make the cat flare. So how do you do it? Well, the first thing you do is make sure you can do it. Make sure you purge the house of all of the things that a cat might actually sabotage the diet with. They need to stay indoors, and you gradually need to introduce the diet over maybe a week, even to 2 weeks. Once you got the cat on that diet, if the cat's itchy, you need to feed them the diet and some kind of medical drug to help stop the itching because they need a comfort drug. So once we're on the food trial solidly, it's about 4 weeks on the comfort drug and the food. And you just progress on. And that cat should be very, very comfortable at the end of 4 weeks. At the end of 4 weeks, you pull the rug out from underneath the cat. You remove the antihistamines or whatever else you were giving the cat, and you just see how does that cat do on just the food. And if that cat just does great on all the foods, you're really tempted to say, my cat has a food allergy. Well, what you need to do there is you need to prove it, and you need to challenge them back with whatever diet they were on when they were itchy. And if that itch comes right back in just a couple of days or even a week, you've got a cat with a food allergy. And great. If, on the other hand, you challenge them and the cat, nothing happens, it may have just been a coincidence that the cat was getting better as the cat with seasonal allergies. So that's something to consider. It's a little bit trickier when you're looking at a cat's, the stools. If you're doing a food trial for a cat with GI signs, your target isn't itching so much as it is what's going on in the litter box. Okay, and then what about allergy testing? Before you pack up your cat, in allergy testing for cats, it's a pretty stressful thing for cats. because, they have to go on a car ride, they get sedated, they get their hair clipped, and stress hormones in cats don't drop very quickly, and they can flatten a skin test very, very quickly, and that gives you negative results, and so that's really expensive if you've taken off time and made an appointment. So you need to make sure the cat's testable, that there's no other drugs on board, and use a lot of feel away, get the cat the first appointment of the day, and does the cat need to be intradermally skin tested, or you can do a blood test? Well, in Raven's study, she found that surprisingly, and has been my experience too, that cats, contrary to what you see, will oftentimes have very, very, very strong positive intradermal skin test reactions. To cover our bases, we do both. We do blood allergy testing and skin testing. And cats can get allergy shots or allergy drops, and about 2 out of 3 cats respond. And that means that they're doing better, and that who's ever administering it feels the cat's doing better, and they want more of the drugs, more of the allergen. Is it the only thing that they're on? Only a very small number of cats, or even dogs for that matter, when they have allergy shots or drops, that's the only medication that they get. They usually are on something else at the same time. But what it is that everything else is so much diminished. You don't need as much of the allergy medication, or you don't have as much bacterial pyoderma in that, or itchy skin. And so that is, kind of the high point of things to emphasize to people. Yes, 20% of cats have environmental allergies if you've worked them up well, only 12% with foods, but it's very cost effective when you think about how much trouble it is to go and get an appointment for cat with skin testing than it is to go ahead and just get the food trial done. Because if you've got that done in a skin test the next thing, then when you're going and you're going and getting your cat ready for a new home, you have that piece of information. And documentation is everything in cats. It's really important to document as much as you can, because if you've looked, not unlike the dog, we've done a triage. In about 6 weeks, it gives us a lot of information. We get Demodex gatoi out of the ballpark. There's no other diseases. We're down to allergy. All that is going to save a foster, a brand new permanent loving home person, a lot of headaches and a lot of money when they go and get some permanent help or additional help for the cat. Now, itchy skin diseases are lifelong if they're in the allergy ballpark. They can be controlled but not cured, but we have a lot of good drugs available for it to do that. And cats with allergies always need some kind of topical or systemic treatment. And you want to use as much as is needed but as little as possible. And the goal is the quality of life. And so, if you go back to the itchy cat odds, you're looking at 40% of cats, you can treat them and cure them. With your 25% of others, you're going to have a diagnosis and a different treatment plan. Another 12% you got on food trials. So you basically, you're looking, food trials are not, if a cat's food allergic, they can be on that diet, and they will do pretty well as long as everyone is really is really into feeding the cat the diet. And so, we're talking only about 20% of cats that may need, chronic cyclosporin therapy or allergy immunotherapy. So, again, we can do a lot up front before this cat gets his little luggage and time to go. So, basically, you can do a lot in a short period of time. This cat is very, very dramatic, and we put this cat into the program. And this is the happy cat picture that we got with the program of our little 6-week triage. So very happy cat, very happy owners, and everybody came out really well. I got this great picture. All right. Lynn, I think it's back to you.
Yes, it's actually question and answer time. Dr. Moriello, there were still some people that did not understand what you said when we talked about the first-line antibiotic. What was that name again?
Okay, the first-line antibiotic is cefovecin, and that is Convenia, in case anybody goes by just trade names. And that's an injectable drug. And as far as first-line goes, that's a first-line systemic when you need to use a systemic drug. You can use Clavamox. It works really well. You can use the smaller tablets of cephalexin. The problem is that cats need about 30 days of treatment, and it's very, very difficult to get owners to pill cats. There was a study that actually showed that the average cat only got about 5 days worth of its treatment. So that's why we're using more of the injectable. The risk of using the injectables, this is a very big gun, antibiotics, is resistance. So the cats with ulcerative lesions, very, very appropriate. The cats where we might be able to do topical therapy, better choice. And it's important, with cefovicin being an injectable, you need to make sure they're back to wherever in 10 days, not 15 or 30, but 10 days. So again, use it, but use it with care. I didn't want to give everybody the impression that we're just using it with reckless abandon.
Yes. Okay, thank you. Let's take our first question here. Can you just do blood allergy testing? Must you do both skin and blood?
Okay, that's a really good question, and I'm glad somebody asked it, so thank you for opening that door. If the best you can do is allergy testing, do allergy blood testing. Use a very good lab. The labs that we like are the ones that will do collaborative research with us, so we use HESCA tests and found that to be very, very good. And again, it's important with blood allergy testing to use a good lab because you're talking about going with a therapy that's going to take 3 months to a year to determine whether or not it works, and then it can become lifelong. For those people who can only do blood allergy testing, do it. Work with your therapy, with what your allergens are. If the cat's not doing better after a year or whatever, then you can talk about referring that cat for intradermal skin testing. But we find that in the grand scheme of things, by the time we get to a cat that's really bad off, that we capture more of the allergens with doing both tests. But you would be doing the cat a great service if you could only do one test. Just don't do the food test for blood. That doesn't work.
Okay, here's the next question. Through food trials, we've established the cat is allergic to chicken. However, if we try to withdraw the cyclosporin to less than 2 times a week, even though on the food it's not allergic to, it starts scratching and sneezing again. How to address? Okay, so if you've got a cat with a known chicken allergy, then the first thing I might want to do is go to a diet that doesn't contain chicken, or if you're using a hydrolyzed diet, it's not going to be antigenic. If you've got a cat that that is not 100% managed on its food, then you probably have a cat that has concurrent environmental allergies. And we don't know the percentage of cats that have both environmental allergies and allergies to pollens and molds, but the key here is less than 2 times a week, you're needing to use the cyclosporin, and the cat is sneezing and scratching again. Cats do get a little bit more respiratory signs. So personally, what I would do if this was my cat, I'd keep him on the diet that he's working on, keep him on cyclosporin to twice a week, and be really happy with that. Unless you want to go with allergy testing to see if you can get immunotherapy on board. Okay, but at least 1 year you'd have. Okay, great. Okay. Sorry, I didn't mean to interrupt. No, it's okay. Next question. Okay, the next question. What are your thoughts on Apoquel? My thoughts on Apoquel. In cats, the studies on toxicity in cats haven't been, if they've been done, they haven't been published by the company. I'm sure they're just starting to do research on that, on use in cats. The only use in cats that I've been aware of is just anecdotal with cats, and it may be effective in some cats. There's some thoughts that the dose may be different. As far as if someone's trying to get me to talk about it in dogs, it's not the cure-all for all dogs. It works in some dogs, and it doesn't work in other dogs. And until this drug is available to everyone all the time, without all of these little embargoes and going off the market and unavailability, we're not going to really know how effective it is, because drug companies publish studies, and that's their study in their population. But the real efficacy of a drug is when it's in everybody's hands in the field. So we'll know more once we can get this drug. Okay, thank you. And here comes the next question. What do you think about Depomedrol use in cats?
Okay, Depomedrol in cats. There is a place for the use of Depomedrol in cats. There are cats that just have seasonal allergies, and one injection controls them. There's cats that are just mutilating themselves and cannot be orally medicated, and you may have to do that. The problem is once you've given it, you can't take it back. And I know that in shelter situations, there's a lot of concern about using repositol injectable steroids in cats because of all the other diseases, and that's a fair concern. Where you get into trouble with using Depomedrol is if you're having, it works, you're usually using 1 or 2 injections, but then you're having to give it more and more frequently, and the cat starts not responding to it. That means that you've missed the underlying cause, that your trigger is still there. But there's a lot of cats that it's been a lifesaver for. I'm not sure what the context is of the question, if they want to use it just short-term or they were just asking about it in general, but that's sort of my opinion.
Okay, great. And this one may be related or maybe not. You're the expert. What pain medication do you recommend for other diagnoses due to self-mutilation?
Okay, I don't deal very much with pain medications in cats very much, but we've used gabapentin in cats because the nonsteroidals are somewhat difficult to use in cats. But gabapentin would be one choice. The other thing I would consider doing is trying to find, if you're looking for a pain medication, what you're trying to do is find out whether or not you've got soft tissue pain or whether you've got orthopedic pain. If you've got orthopedic pain, then what I would do is look to see what are the treatments of choice for cats with orthopedic pain. For cats, some cats that have got other pain or what we perceive to be maybe referred pain, gabapentin will help. That's a question I would punt to internists because by the time we get to this, we're usually working with a number of other specialists, and they want to be preaching drugs which are potentially problematic to use in cats.
Okay, another question is coming up. What antibiotic do you use for
eosinophilic lesions?
Okay.
Eosinophilic lesions, got it. Is cephalexin a good choice? Cephalexin is an excellent choice. Cephalexin is a great choice, 30 milligrams per kilogram. I use it twice a day. That works well. Some people will use topical antibiotics on those areas. I prefer to keep the area clean. And if you put a topical antibiotic on it, the cat will go ahead and get it's going to lick it off, and they may ingest it. The one that is used very widely is mupirocin ointment. But, yeah, cephalexin is great.
Okay, thanks. What is the next systematic therapy recommended if itraconazole is no longer a cost option in the shelter setting? We're currently using terbinafine. Yes, but I'm seeing decreased efficacy. Okay.
Itraconazole is expensive. Compounded itraconazole must be avoided at all costs because the research grade is not absorbable. So you need to be using the trade name, and itrafungal is not available in this country, so you need to be using Sporanox. Now with terbinafine, terbinafine does not work as well against yeast as itraconazole does. It does work very well against dermatophytosis, and it actually has a better killing ability than itraconazole in some studies. The thing with terbinafine is that it needs to be used at 40 milligrams per kilogram once a day, and it's in a big tablet, a big 250 milligram tablet. So sometimes it's hard to get to that dose, and it causes a lot more GI upset. So when I am talking to people and they're seeing decreased efficacy, particularly with dermatophytosis, lots of times you'll get the history that the cats have a lot of GI upset and they're just puking a lot, and they just can't keep the drug down. to do that. But we're sort of, the other option you have, of course, is fluconazole, which is also generic. But you need to use at the higher end of the level, like 10 milligrams per kilogram.
Okay, we have time for a few more questions here, and here's the next one, and it's an interesting question. Do you find cats are allergic to the bowl instead of the food? Would you recommend changing that first before doing a food trial?
Oh, great question. Okay.
Yes.
So a long time ago, there actually was a dye in the foods, in the plastic dishes, that was problematic not only to everybody, to people and they've taken that out. Now, cats, the thing with cats and bowls is one of the things that a lot of people don't realize is that, cats really need a big bowl. It needs to be whisker to whisker. And if their whiskers are kind of bent up, then what they'll do is they'll get a lot more food and water on their face, and what they'll get is bacterial and yeast infection overgrowth just because they got a dirty face just like a little kid. So there's absolutely no problem with changing, before doing a food trial, is go ahead and change the bowl to two things. One, something that you wash every single day. So you can feed the cat its food on paper plates, and that's great. But put its water bowl really big and make sure it is ceramic or Pyrex or something that can be washed. Avoid metal because it's nickel. There's just a lot of things we don't know about cats, but nickel is a big cause of allergies in people. And again, cats, when people give them these little bitty bowls, they can't help but have a lot of moisture collect, and that could be problematic, and then they could have head and facial itching, and it can definitely mimic a food allergy. So, great question. Thanks for asking.
Great. Okay, here's the next question. Do you worry about anaphylaxis with Neopolydex?
I have not had that happen to me yet. If that has, what can happen with the neomycin is you can get a cat that will have a local drug reaction if they've had repeated application of that to the area, and it's basically called a fixed drug eruption. And the same thing will happen. The cats that may be developing it with Neopolydex are cats that have probably had a lot of the equivalent of the Panalog or Animax, that kind of neomycin, bacitracin kind of steroid combinations to do that. Cats, when they get anaphylaxis, remember it's respiratory in cats, GI.
Okay, here's a brief question. What stain do you like for cytology?
Okay, my favorite stain for cytology is to use Diffquick. The key there is is to use very small volumes so you can change the stains frequently. Keep them covered because they get dust on them. And remember that your fixative will evaporate, so you want to do that. When you are doing the red stain first, before you put it into the blue, tap it off and allow all of the stain as much as you can to wipe off. Then go dipping into the blue stain. And you want it, whatever number of dips you do for red, double or triple the dips in the blue, because it is the blue that is going to help you find the organisms you're looking for. Actually, there are some dermatologists that only use the blue part of the stain. I have used methylene blue and to try for cytologies, and it's still not as good as Diffquick. But Diffquick is expensive, but the key there is to use a very small volume. So get those little jars for the stain, and then have two sets of jars so that you can change them every week, depending on how many cytologies you're doing. But they really need to be changed, and it's cost-effective when you use maybe 10 or 15 mils at a time, and not 40 or 50.
Okay, what is the general prevalence of D. gatoi in cats?
D. gatoi in cats. We don't know that. The Demodicosis gatoi is part of the normal flora of cats. It cannot live anywhere else but on a cat. It's just too fragile. And so it's present everywhere in cats. Why do they develop it? Cats develop a hypersensitivity to this mite. And are we eliminating the whole mite when we treat them? just like we do in dogs. Well, you never really get rid of every Demodex mite in a dog. You're essentially treating the overgrowth. And I think what's happening is when you're treating dogs and you're treating cats with Demodicosis, and you get them in remission, is not only do you kill the overgrowth of mites that are causing the problem, but at some point in there, the physiological stress, which is triggering the problem, is getting resolved.
Okay, we'll take one more question here. What do you recommend for kittens 4 to 8 weeks old that have ringworm or sarcoptic mange that you can't use flea preventive on?
I'm just trying to make sure I understand the question. Kittens 4 to 6 weeks of age. Okay. If we're talking about, when you're talking about kittens here, and it's life or death with kittens, then you need to use the products which are going to be effective. Now, as far as safety, I've used Advantage, and I've used Frontline on kittens as young as 4 weeks of age. One thing I would like to make a big note for is that lime sulfur will kill just about anything that's on, will even kill fleas. It just has no residual activity. So if the cat says it's too young for flea control, what you can do, if you've got mites, you can use lime sulfur. And if you have a flea problem, then you're going to have to treat that kitten somehow. And you may be using it off the age limit, but kittens can die of flea bite anemia. So I would go with lime sulfur as a first thing. I would clean up the environment, treat everybody in contact with it, and use pyrethrin spray, use Frontline spray, or even Advantage. They have a high margin of safety, but still you need to treat that cat, or it's going to die if it's got a really bad flea infestation.
Well, thank you, Dr. Moriello. This has been a really interesting presentation tonight. That's the end of our event, and of course, we want to thank all of you in the audience for your time this evening. We invite you to take a few minutes to complete our survey. Your feedback is important to us. Click on the link on your screen to take the survey. If for some reason you don't see the link, it is also in the resource file at the bottom of your screen, and the link will be emailed to you in a few days. We hope you checked out the resources in the widget. If not, we'll be emailing the links to you. Remember to print and save your certificate of attendance. This webcast will be available on demand within a week, and we hope you'll share this presentation on your social sites. Make plans to join us for our next webcast, Assessing Your Community to Save More Animal Lives, with Bonnie Brown on March 19th. Get more information and register on our website at www.maddiesinstitute.org. The Dermatology series with Dr. Moriello will continue with 2 more webcasts in May. Thanks again for being here with us this evening. Good night, everyone.